So the goal of this presentation is to emphasize the value of engaging the media in global health research. We will also analyze the factors that influence transmission and reception of scientific research using the media as a conduit for scientific communication. And number 3, we'll identify approaches and highlight available opportunities. This has been our pulse. Available opportunities, available opportunities, available opportunities for engaging with the media. Already, the opportunity has been provided. You have, some of you met with the partners from the media who are here, and probably that's an opportunity that has started in its own self. And finally, we'll identify ways of overcoming challenges for scientists in engaging with the media. Okay, that means there are challenges. There's mistrust. There's mistrust between the media and researchers. You must have already heard from Simon's introduction and also Florence. They had sentiments that were underlying there. So the media in the past has been portrayed, and we're saying in the past, but for some of us it could be even now, has portrayed researchers as exploitative and as using people as guinea pigs. Health researchers on their part have had a dismissive attitude towards the media. You remember the story, the cartoon we had in Professor Sewankambo's presentation, where the researcher was, the policymakers were in the balloon up there, and the researcher was answering questions. Sorry, you guys didn't see the cartoon, so it doesn't make sense. But there is a bit of skepticism. Statements like journalists tend to look for sensational results, which they misrepresent, whereas science usually advances by a series of incremental steps, and there you add very other big words normally. These are statements made by a certain group of people. Researchers, on the other hand, the media also says researchers use jargon, and this was intimated this morning already, when reporting, which cause misrepresentation and misinterpretation of facts. Consequently, some journalists consider research as complicated and unattractive, and some repel reporting on research issues. And these statements can be verified. We have Kathy here. You have a fleet of journalists who report and who you sit with in editorial meetings, and probably not many of them are excited about reporting science. You will know about that. Researchers also continue to communicate to their peers in scientific conferences and peer-reviewed journals, but not much outside. And I put this one here. What about society? When these two elephants are fighting, society loses out, because research is done for society, and media is there to serve society. But the two of us are fighting, and ultimately no business happens. So why do we engage with research, with media in global research? The media can potentially influence public attitudes. This doesn't need any further elucidation. Through its role of sensitization and publicity, as it is the public's most significant source of information. And we know that this is the truth. When you see people dressing in a certain way, most likely there's a media part to it. When you see people speaking in a certain way, media has influence. They influence language, they influence all sorts of things. The quality information is needed for any country to develop. And frankly speaking, there is no place to get the most quality of information than from research. Because if you understand the rigor of research, you will understand that the result of research are probably the most qualitative, because researchers are always questioning, but why, but why? So the final product they have is very quality, high quality information, and yet it's not utilized. So when presenting this information to the public through the media, it should be simple and consistently accurate. But the things we talked about above there, the misrepresentation, the mistrust, the misunderstanding, they compromise They compromise the consistent accuracy. So today, Florence is a science reporter. She will report well on a certain matter, and then tomorrow you realize, oh my God, that was not exactly true. Yesterday, somebody shared the experience of how the media really misrepresented what they said, and we will say more about it today. Anne, who refused me to call her professor, but Professor Anne, who is among us here, did some work in 2010. They were reviewing content of media reporting on health, and they found that reporting on health in Uganda did not draw a lot on local research. A lot of what was said was stuff they got from Google and other sources. And that is telling, why don't they draw on local research? The question is, where should they find local research? Problems arise when the media misunderstands the researcher and misinterprets and misreports the research findings. Okay. Timely information helps the media understand what the key message that the researcher is trying to communicate. The key message the researcher is trying to communicate, thereby reducing the risk of misrepresentation. So researchers are usually not, reporters are not normally qualified health workers. So they prefer to quote a credible source. When they quote the researcher, they are surer, they are more confident. So engaging them is a good idea. Interaction with the media helps researchers put a face to sometimes complex issues. You know, when you do your work and it's about biomarkers and it's about the genome or whatever, and you use this language, when you come to the journalist, they will require that you simplify it. The process of simplifying it helps you, even the researcher, to understand your work better. And so we need to engage them. So journalists represent the public. If they don't understand, most likely the public won't understand. And the public is that minister you're trying to influence. The public is that decision maker you're trying to influence. But the public is that grandmother in the village who needs the therapy you have discovered. So good media reports can raise the profile of a research. This is why we're continuing on why we should engage, trying to make a case. Good media reports can raise the profile of research for the institution. And it can even raise funds. I think Peter was talking here and they were asking, but what is your motivation? I liked your honesty. That's, part of it is money. They're just part of us. They are facilitating with us in this. So please put your guards down. Okay? Media is one of the most quoted sources of information, and by policymakers, unfortunately. So once they profile a research, chances that policymakers will appreciate it are high. And so we need the media making the case. The process of simplifying research findings to make them understandable to lay publics helps the researcher focus their thinking to address real felt needs. Just imagine if you're thinking this at design time, even the way you conduct the research and the way you will collect the data and the way you will analyze it and the way you will disseminate it will be real society focused. Scientists know the science, but they don't have the audience that needs the science. The media do. The public are not passive recipients. They prefer to exchange ideas, especially these ones we're educating today. My kids ask real tough questions. They ask tough questions. Even those in UPE now, they are asking. This is how they change behavior. When people ask and get answers and they ask again, and then they are able to change behavior. Now, if research is to change behavior, we must create avenues where the research users can ask questions. And media provides that. Media know how to sell concept to the public. They are good conduits. They sell a concept until a fuel station, any fuel station, is called Seru. You know, when I was growing up, they used to say, Genda ku Seru ya Toto. Because Shell had advertised so much that any fuel station was Seru. Hey, endo gule corrugate wa detergent. You have heard those words. Because the concept has been drummed in. So if we could succeed in getting our research work sold at that level, we will see change in behavior. So there are approaches for media engagement, and we will not go into the depths of these. After all, the experts are here. So I have put up a few things. Yeah, media releases, and in there you have press releases, you have news releases, press statements, op-eds, opinion. If you have a terminology you've never understood, you see it in the papers, commentary. What is that? How do I get to that? What's the difference between opinion and commentary? What's the difference between editorial and op-ed? What? You know, you see the things. What? How? The guys are here, and we're going to get into that. Others are evidence briefs. We talked about evidence briefs yesterday and popular summaries. We said you can organize media breakfasts. You can even organize media trips. You've done work, Peter. You've done work in Mayuge district, and it has really impacted lives. You want the world to know about it. Talk to Simon, talk to Florence, talk to Kathy. They'll find you people who can come alongside you. Take them, let them talk to the real people. Let them talk to the leaders of those people. And watch the story that will come out and the impact of that story. You know? So let's utilize these opportunities. And in this college, we have innovations clinics where we bring together researchers and the users. And the users usually include the media. These are opportunities for interaction. Video recording facilities. The gentleman you see here is, I have already talked about. As a college, we have a facility that you can use to record a piece of your work. Send it to the TV station. Tell them, look, I've done this work. Would you like to use it? We play. Could be interesting. Could be very interesting. Or put it online. You tell him, make it small enough that it can go online. And do that. If you are the kind of person who doesn't want to write, or you're communicating to people who don't want to read. The video system facilities here. You could actually make it audio. People can just listen to it as they drive their car. And you're making points about what you have found. We're talking about making research matter in society. And the facilities are here. My office, which is the Innovations and Knowledge Translation Office, can help you shape all this, put all this together. And this is not a fee. This is not something you need to pay for. You just come to me and we work together. We've got a lot of support from the Sure office. They have put together lots of templates. There's a lot of plug and play already available, ready to run. Challenges, and this is probably my last slide. Journalists may need some degree of specialization in health reporting to more accurately interpret science reports. I don't know whether we're here where somebody say that they went to Parliament and this researcher was talking about the margin of error. And the MP put his hand up and said, this thing you're presenting is full of error? So because the specialization, I mean, it's a bit of understanding of research. You may reduce it and translate it to a certain level, but even the journalists need some degree of understanding of health. Editorial policies, and we'll ask a few questions about this. Editorial policies are policies that drive media houses. As a media house, we do not take the report you give us. I worked for a media house before, and one of the policies we had in that media house was, when we come to report, you don't tell us what to report. And this is, I think, acceptable journalism. You don't tell me what to report, just give me what you have, and I'll see what to report about it. So that's called editorial independence. Don't force me, you know. This media house I was working for one time got $5 million from USAID. Anybody who has worked with USAID knows that USAID gives you money and they follow it. They tell you how to use it. And this was a media house which has editorial independence. Ended up taking back the money. Because they saying you must do this like this. You must have this one and this one in the studio. You must. So the money was taken back. So issues of editorial independence, how do they affect the way we work? I mean, editorial policy would be that we don't do health. For us, we are purely politics. You know, we are purely sex and love and fashion, and this is all happening today. They are competing more public interest stories, and media is always thinking about public interest. So then we have to tailor our work in such a way that it's public interest. So sometimes when you have got, you have isolated something microbiological and you want to report it to the media, maybe it may not be the right forum to talk to. So yes, we want to talk to the media, but not for everything that we produce. Some of it may not be relevant to them. Political affiliations of the media houses versus editorial independence, and you'll find this a lot during the election time, that people will not be allowed to report on certain things because they may not reflect well on a certain group of candidates, and they own the media station. Or if you're considering the reading, written media, then the reading culture is another problem.